Oh, that's new. Did you guys hear that?
Yeah.
Okay. Okay. Okay, so we might as well. Oh, everybody else muted and you've left it to me. And this is really, okay, so where shall we start? What should we start with? How to pick them? Do you have an idea?
Yes. I think you mean start off with? I didn't get you.
Yeah, a topic. I'm going to give up on this camera soon.
I thought that today's herbs and homeopathy.
Yes.
Okay, so we could. I wanted to know about Indian herbs. Like we have spoken a lot about Angelica, shepherd's purse, and all of that, but I wanted to understand what is that equivalent of shepherd's purse in India and the
Well,
local herbs that have been used traditionally.
okay, so oh, that's why Suvarna's here. So are you there, Suvarna? Can you?
I
Yep.
less because it's my husband's topic, not mine. So it's I whenever I have doubt, I ask him. That's it.
Right, right.
He's the encyclopedia.
You know, there
So
is
I
a
really know. Yeah, Arpita.
Suvarna, there is a Tamil proverb.
Uh huh.
Okay, so you don't take it offensively. It's like, take
No,
it in
no.
a lighter vein. So there is a Tamil proverb that goes like, the meaning is, in a garland, along with the flowers, the thread that binds the flowers also starts being very fragrant. Like, because of being so close to the flowers. So,
Yeah.
since you interact so closely with your husband, you could have as well absorbed all his, at least like
Yeah.
1/10 of his wisdom, and you
Yeah.
can share that with
I
us.
know. But I really that's what I was thinking. Like when few years back when Kale messaged me, you will be there, or I was thinking that even in my pregnancy or in general, like after the like in postpartum period or with the baby, I was more intuitive or instinctive. Like I didn't use anything most of the pregnancy and even for the baby for a whole year. It's been 14 15 months now, and for my baby I didn't use anything, any medicine. I never used. I just use some herbs which are like which they use in general for immunity, that you paste it and you make a paste and give it to the baby after the baby is born, from like after 15 days. And I used to give it till 6 months, and that's it. Like after that I didn't use anything.
Okay,
And
okay.
the most of the time it's basically I think it's most of the time you need to look at what changes you have done in your lifestyle or maybe in your diet, and you know what's the reason of the disease, right?
Mm, okay.
You can mostly then only you can know the solutions. Like that's what I was thinking. I don't know, like i I don't know if does that make sense to you, or
It definitely makes sense, but what if you have somebody who's not so in tune with their body, who's not so in tune with their self? Like,
yeah.
Yeah.
Yeah, for them we definitely need these herbs for sure. And yes, I was reading them, like, and I will for sure I will study them. I have so many books of my husband which I need to study, and there are so many things that are written, like so many simple things and like herbs and which you can get really normally in the nature. And when you go outside, if you get neem tree and bale tree and like so many very, like you have those trees near around you, and you just need to know that it's helpful in these conditions.
Okay, so, okay, so Kavita, do you have experience in this? or who actually, does anybody here, is anybody experience, okay, because you've mentioned Artapita and it's true. You're looking for herbs that you can access, and it's appropriate. It's appropriate for you to be using the herbs from your place, right? Obviously. And I actually believe too that where you're from, you know, you're kind of connected to this. I think even if you move overseas and if you're born and then you start living overseas, even still, like the DNA from your body comes from the earth, right? Comes from your earth, which happens to be India, which is vastly different from this place and that place. And I believe so. While like I can throw, and you're right, I can throw out. Mostly I work with herbs. Some of the things that I do work with are Indian as well. They come from it. For instance, fennel, dhania, fenugreek, right? All these things do different things, at different times. As an example, if you want to increase breast milk, you can either make a tea of fennel, or you soak fennel, like a couple of tablespoons of fennel in a liter of water, and then drink that throughout the day, or you make a tea. And my God, watch out. Don't just think you need to do this, because it works. Once it turns the milk on, you will regret it. If you thought if you know, if it, yeah, it goes hard. I know that black cumin, jira. Oh, no, not jira. What's the other one for black cumin? But anyway, that I know it can. I've known it to be implicated in a miscarriage. Um, it the father accidentally gave black cumin. He was trying to give something else, and he made a mistake, and it actually caused a miscarriage. I also work with homeopathy, and you asked about homeopathy, and of course my downfall is I left all my materials in India, or they're in a container somewhere else. And a lot of but even I can sit here and prattle off a lot of stuff to you, but it's all it's not really that good, is it? You're really better off finding a series of good books. And we've mentioned repeatedly about diagnostic test for the childbearing years. And this woman uses homeopathy as well. But there's also, besides just herbs, it depends what the issue is, right? Sometimes it can be something physical we do. Sometimes it can, you'd be surprised what works suddenly without explanation. I've told you the story of this one, in fact, it's the series of photos that I showed that, with me supporting it was in a magazine. That's the lady. This is the birth. So after she had her baby, this baby wouldn't drink. He would not latch on to the breast, and he would just get there and just kind of fall away. And then this went on for like a week, and it was getting bad, and he was losing weight, and I've never seen anything like it. And I went back, and I will run over. I do have a book. Hang on, I'll get a book in a minute. But I went to this book, and it was about essential oil, flower essences. And in this one, they're using Indian flower essences, American, and I think they even touch upon Aboriginal. But so I'm with her, and I'm frustrated. I've brought I'm actually brought formula, believe it or not, never ever before. Yeah, I brought formula to the house. Never ever would I've done such a thing. But I brought it, but I didn't want to use it. And I just kind of sat there and talked to the mother. And she said, I and I knew her brother. Her brother was actually suicidal, had attempted to kill himself, and I knew there were issues in the family. And she said, I just feel like he doesn't care if he lives or dies. He reminds me of my brother. He doesn't care if he lives or dies. And I thought about that, and there he was, he just, yep, didn't care. So anyway, I just thought about it, went back, checked this book, and mixed up a couple of flower essences based on what she had emotionally told me. And I went back to the house, straight away, and she put him to the breast. She was getting ready to feed him, and he was kind of sitting there, blah, off to the side. So I just took the dropper and just dropped a couple of drops on his temple right here, and he just went, and he latched on, straight away latched on, had a healthy, strong latch. That blew my mind. If I, that made me believe it. It was just crazy because this is a week old and nothing was working, and I had gotten to the point of providing formula. I mean, not he never got it, but just this one thing, and he woke up and he shook his head like that, like he just woke up. It's like he woke up from a dream and snapped to and realized he was starving to death. Yeah, I think he kind of realized he was starving to death because he latched on and he never stopped. It never happened again. And he just woke up. So sometimes depends what the situation is. You have to, I can't really sit. It's hard to sit and say, take this, take that. It's better to hear what the situation is. I always sit down and I say that how I always talk to the women in the family and sit in the house too. Yeah. Especially, yeah, it's good to sit in the house, in the home. If you can. I know many of you are in hospitals and other settings. But if you can, sit in the house and see what's going on. See if the house gives you clues as to what the real problem is. And even if you're dealing with homeopathy, right? Excuse me. If you're dealing with homeopathy, if you're dealing with flower essences, I don't know about Ayurveda, but actually a bit to a degree, you're dealing with emotions in Ayurveda. So you get a good grip of how people are feeling in their home environment. And by doing, so understanding the emotional content or basis or history is part of many of your traditional alternative medicines. Um, what else can I say? What else do you guys have anything specific you want to throw out? Wait, let me run and go get something, that book. Let me see that book.
Till she comes, I'll just add something that being instinctive and like 2 days back, I had not sore nipple, you can say ulceration of nipple while my baby was playing with my nipples while breastfeeding, and it was kind of blood was coming out, and like he just did like a strong bite kind of thing. He just wanted to play with it, and uh, it was kind of ulceration, and it was so painful, and I I could not avoid the breastfeeding him because he wanted to have it in the night. And like during the day you can avoid it somehow, like you can just do something with them, and but during the night he just wanted to have it, and I just continued breastfeeding, and my breast was swollen. And in the morning, when I saw it, and I was thinking, what can be done? And there should be something I should apply it. And suddenly, like all of a sudden, I just thought of ghee, and I applied it, and I had it, which I made it. And within one day, it was healed, like totally, absolutely healed.
Oh, yeah.
It's so like it was so relief for me, and that was like simple ghee which was made in home, made at home. Like, it was not buy from outstores. So simple things will. There are so many things in our house which can heal ourselves if we just use it thoughtfully.
Mm-hmm. And while you mentioned that, honey too, and raw honey, by that I mean raw honey, is an amazing healer. It has the same bacteria that our bodies generate, that our bodies have when we have tears or injuries. Raw honey contains the same bacteria. I've known women. Oh, I knew this Dutch midwife who she had all her kids at home, and she actually had a third-degree tear and with one of her kids, and she used honey. She stayed home and used raw honey, and it healed up very quickly and nicely. Um, so here's this book that I was talking about. Oh, can you see that, or is it backwards? It's backwards, huh? Okay. Yeah, so I guess it's hard to explain, but anyway, these kinds of things where
what happened?
it works from, as an example, attachment or apathy or appreciation or attention. Apathy. I probably looked at apathy. Apathy means I don't care. So under the heading of apathy, I would have found some remedies I thought that sounded appropriate for this child.
Why would I do that? Well, if you'd invited me, I would have come today. Yes. But then I was like, oh, maybe I'll go.
Was that to me? Wasn't to me, was it? Okay, now I'm silenced. So where else to go? Go with this? Anybody have a question, or Heidi, do you have something?
No, I'm good. Thanks. Sorry.
Darn.
There was a situation. The cat had a snake and the dog was going crazy, and that's why I'm late. But they can sort themselves out now. I've closed all the doors and windows.
I understand what you mean. I actually do. Okay. Does anybody have anything else specific that you or not even specific? What areas of complication do you see that you seek, that you would like to know about?
Oh, can you hear me?
Yep.
Well, I mean, I'm carrying all my tinctures. I just want to know if there are Ayurvedic alternatives to, for example, shepherd's purse, angelica, and other stuff that I carry. I mean, homeopathy is widely available in India, of course. And Ayurvedic alternatives, for example, to stop bleeding. If the placenta is not out, I'll be using angelica, and if the placenta is out, I'll be using the shepherd's purse. Angelica I have used with success in one case where placenta was not coming for 2.5 hours and the mom was having after pains. And in 10 drops, it worked. I mean, the placenta just detached. I knew it because she had a massive contraction. And afterwards, she just passed out the placenta. So it's like, so does anybody know like the emergency Ayurveda kind of thing.
I don't. Oh, no. Oh, you know, in India they do the ponytail, right? To get rid of the placenta, right? You know that? How they take the plaques, the ponytail, and push it. They I've seen dyes do this, and then they, you know, it makes them gag, and that pushes out the. That's what they do. One of the ways. If
Yeah,
you,
actually,
Yeah.
yes.
actually, my maid, she used to assist traditional midwives, and she used to tell me like they'll be taking the mother's own hair and put it in the mother's mouth to gag out, to
Yep.
push the placenta out.
Yep. Yep.
And also, she mentioned one more thing. They used to carry the charcoal. They used to powder the charcoal, and with a cloth, with the charcoal inside, they'll be rolling a cloth like big stick, kind of like moxa stick,
Mhm.
and they used to carry that to the labor
Oh,
when the baby is not coming out. Like, it is like if baby is getting struck out, they'll be inserting that roll inside the anus of the mother, and otherwise if they are not having, the midwife would put the big toe midwife's big toe into the mother's anus to release the restriction, and the baby will be delivered. I'm not sure why they are doing that.
yeah, me neither. It's interesting. I wonder what they're doing or what they're looking for.
I
Maybe they
thought
are
it would be kind of sacroiliac maybe that
yeah,
ligament
Ayurveda
would
might be able. Kavita,
Sorry. Continue. Say. Oh, okay.
yeah, I
Yeah.
said
I can't hear you.
Kavita might be able to tell us what she uses it in her practice. Able to.
Can you hear all of you?
Yeah, I can. Well, I could hear Tapasya, but she's okay. And then
Yeah,
oh, and
maybe,
Kavita, I can hear Kavita.
yeah, maybe, I'm not very much sure, but I've not, like, maybe a pelvic
Kavita,
floor
I think you
must be
can keep your mic near your mouth. It is little
out.
not much
So is
audible.
it audible now?
Yeah, yes.
Yeah. So maybe with a pelvic floor perspective, maybe doing that may, it can uh, irritate, or or it can relax. I don't know. I'm not very much sure of the pelvic floor. Maybe because of which maybe it is possible, but I'm not very much sure of. But other than that, but it is not related to ligament. Definitely, ligament is like it is connecting the uterus to the pelvic bone. So doing something in the pelvic floor generally, it's like it will not, I think, have any effect over the ligament, but maybe over the pelvic floor, yes. Inserting something into the anus will have the impact over the pelvic floor muscle. Yeah, I also remembered because my granny, who had like 4 home births and who used to help her sister-in-laws and everybody give birth, said that the most important tool she used to carry for these births is a peacock feather. And she said around the pushing stage, she used to stroke it around their anus, around their buttocks, around their anus. And it apparently, she says that she didn't give a scientific explanation. She just said that it helps them to really push. It's like, so in India, peacock is like it's represented with a god called Muruga. So they kind of imagine the god's presence with it. But I think hearing Kavita, it suddenly struck her that, oh, they are relaxing the perineum with it.
That's
Yeah.
so interesting.
Yeah.
Well, because, I find that interesting because, as we know, really pushing and that whole crowning, that whole thing is really an anal experience. And I've said before that, or I had this one childbirth educator who would say she put $50 in the middle of the floor and say, I'll give it to anybody who can take a dump in the middle of the floor in front of us. Nobody can do it. Everybody's shy and couldn't possibly let go like that. But here a woman has to push out her baby, and it's a very anal experience. And many times you are pushing out stool with it. And women do get embarrassed about it. They worry about it. They get embarrassed about it, especially in a water birth. They can get concerned about it, but we talk about it ahead of time, so it's no big deal. But yeah, that's interesting. So I can see, I can kind of connect with that. I'm not sure exactly. I can see how the anal aspect, if I can say that. We will call it
Yeah,
that. The anal aspect.
They
it's
also,
actually true. It's actually true. In my mentor in US says that you have to build such a relationship in your prenatal with the woman that she should be able to poop in front of you. I mean, you have to have that kind of confidence and trust building in your prenatals, because yeah, we are working in home settings and it all works on trust. It's not that. And of course, I mean, in hospitals, if you don't poop in front of the doctor, you can't give birth in front of him.
Oh, and that's got to be
And
another
that's why we
element.
have so many stall labors. It's as simple as that. But yeah.
Well, it's certainly got to have an impact, doesn't it? If you in India, it's all kind of so private and shy and whatever. I don't know. I don't understand actually how you guys do it with that culture. I just don't. So really, I just don't know how guys ended up in there. How the heck did you guys let them in? You guys should have stood guard, never let them in. Anyway. What else can we say? What else? What else do we have?
I'm sorry, I may have to log out now to get into another call. But so nice meeting you all and listening to your wisdom. Thank you so much.
Thanks,
See you.
Adrika. I hope to see you again.
Yeah, see you soon next week.
See ya. Yeah, so I'm sorry I don't have what else can I say? I don't have a whole lot with this, but you know what I want to touch upon? I actually, so how do I say your name? Karpaga? What's the one in the middle of my thing? Dr. Raj Kumar.
No,
This
that's
is
Harini. That's Harini.
That's my
Oh
husband.
my God, I'm so bad. I'm so bad. This is what I'm trying to say. I'm really bad. You're not allowed to pull your hair back. You have to look the same every time. Don't do this to me. I'm too old. Oh my God, I'm such a thing. Hang on. So you sound like you have some experience along these ways and some, with this connection you're talking about the dyes and stuff. Do you or not? You?
Yeah, I have quite a specific question for Harini.
Mm.
If there is slight increase in tension, or we see like 140s and 140 80 or 140 100, the in third trimester, the BP. Can you hear me?
Sorry, can you ask that
No,
again?
actually, it is breaking out.
I could hear you.
Breaking actually, and my
Okay.
internet is slow here.
Okay, I don't know.
Don't have a
So some naturopathic treatments for like for example, if I have some hypertensive mom, I'll tell her to take Epsom salt baths and magnesium supplement. Um, so I wanted to know in naturopathy, what do you do to lower the BP?
So there is two treatments I used to give. One is like ice pack, gel pack. We can just wrap inside a cloth, and I used to keep it in the nape of the neck over here. So that will reduce their BP within minutes. And there is another treatment is cold spinal pack. So where just fold the towel in just to make keep the towel over the spine, just this much breath, and I just soak it in a cold water, and I'll keep it over the spine. That they can take by lying in a chair with the support of the chair, leaning forward, and we can apply that pack. That will also help. And Brahmari pranayama, that making humming bee sound with while exhalation. So these three will reduce the BP like anything. This is the simple remedies that we can do, and it is also used to maintain the BP levels. So at least 3 times a day or 4 times a day, if they do Brahmari, and at least twice a day if they keep a spinal pack, yes, it will help to keep their BP in check. And we have to check their diet also. So we have to keep checking their diet. If it is okay, then it's fine.
Okay.
Diet means, do you mean salt restrictions? Because salt restriction is actually adversely affects
I
the.
don't go. Yeah, actually, I don't go with salt restrictions. I just ask the
Yeah.
mothers to avoid dehydrated foods, just like dosa, chapati, or if they take, they have to take lots of water. And I used to suggest what they like. If they like salt, yes, they can take. Otherwise, if they don't like salt, then they can take it, and they won't taste. Like how much they prefer, then they can take that. And I use general restriction was like I used to tell them to avoid iodized salt during pregnancy, especially during pregnancy, because consuming lots of iodine during pregnancy is not advised. And we are seeing hypothyroid kids, babies, and everything. So I just want to avoid the iodine, uh, yeah, iodized salts mainly. So I just ask them to go with normal sea salt and or Himalayan salt. I don't give many other restrictions, but yes, I ask them to avoid rajasic foods, which gives which increases their adrenaline secretions and everything. So I just ask them to go with sattvic foods mainly. Tamasic is like for cheat days they can go with tamasic food, but I ask them to avoid rajasic foods.
Makes sense. Anything else? Anybody?
So
There are so many herbs and things used in postpartum. So if Suvarna or Harini can elaborate a little bit on, like, to reduce pain, discomfort, to help the mother relax, or well, sleep is difficult with a newborn. But and the things we used to have of massage and yoni steaming. Can you talk a little bit about that?
Yeah, yoni steaming is really the best thing which they do, I think, and I just loved it when I did it. And, it, and I and you can do it just, there are so many herbs, but you can do whatever is really available. The main thing is neem and ajwain. And if there is, so these two are main. You can take charcoal and neem and ajwain, and you can just take that steaming to your yoni plus your breasts. You can take that steam to your breast too. And yeah, with neem and charcoal, with neem, ajwain, and charcoal. Like you'd burn charcoal, and
Oh, ajwain.
on that,
Okay, got it.
yeah, on the burnt charcoal, you can put the neem leaves and ajwain,
Okay.
which is really easily available in India.
Yeah. Perfect.
So does it help in well women care as well? I mean, if you're not pregnant, when do you do yoni steams? Before periods, after your periods? Because I know it's yoni steams are used for as fertility treatments as well
Yep.
in Ayurveda.
Yep.
Well, I don't have any idea about fertility treatment. I need to see, but for postpartum, I'm sure like they do it, and it's very useful. Like it really gives you that that pain relief kind of thing is really there. And mostly that there's see, you get irritated after that. There's no bleeding, but there's some discharge, and you get really irritated with it, and that will go really like really fast, and it's, you will feel like it's healed, like it's dry and healed. And what I've heard is for like before the baby comes, that you put the cotton tampon with the oil inside your yoni, and just like maybe a finger, like a finger depth inside, and so that you can take it out, and that will, then you will not have any infections, and you can do it in normal, like normally if you have white discharge or any infections, then you just put that cotton tampon, put in the medical, like herbal oil, maybe neem oil, or just maybe the pure coconut oil, and you can put that cotton inside your yoni and take it out. And with the breast milk increase, I mean everybody knows shatavari, but what I realized it, shatavari mixed, because it's really little bitter to taste. So instead of mixing it with the milk, because the milk, again the milk becomes bitter and it becomes horrible to taste, and people who don't like it, or don't like milk, it becomes really horrible for them to take it. So if you take it with the jaggery and ghee, so it's like a very sweet combination. At least you can eat that. Make a paste with the ghee and jaggery, and it's kind of, at least like it's tastier than what you mix when you mixed it with the milk. So if you take that shatavari, it's immediately after the baby is born. I think there won't be any milk deficiency. There will be a lot of milk, and you take it like before, like as soon as the baby is born, you take it after the food, and maybe every 3 hours there will be a lot of milk.
I have seen this general misconception in India because as soon as the baby is born, the people around the mom start stressing her about the milk, but the fact is the milk does not flow in until the third morning after birth. It is colostrum that is going. And then people start giving, I don't know, goat milk,
Formula.
cow milk, sugar
Formula.
water, whatever things. I mean, there is so much misconception about breastfeeding. The baby just should latch, get the colostrum, and that is enough for like first 48 hours. If you're not doing the immediate cord clamping, if the baby is getting all the blood, then it's not even needed. But oh my god,
Stressed
the
by people.
mom-in-laws and wow,
Yeah.
crazy.
It's actually stress given by people, which makes the which that's why milk doesn't come actually
Yeah.
by the stress of yeah.
It's very rare for there to be a problem with breast milk production. It really, and in fact, you really need to leave them alone. I mean, and I know in India, this is almost this is an impossibility, isn't it? But in the West here, I would say try to make it that you actually give yourself 2 weeks where you don't have anybody coming in. And the Japanese, that's their style. The Japanese take 28 days after the woman gives birth, and no one's allowed to visit. And it's just her and her family, and people will bring her food and take care of her, but they let them be at peace. And in the West, I would do this too. And I put a sign out, or get them to put a sign out. Everybody, please leave us alone for this period of time. But in the end, of course, then you can call anybody you want. When you feel like company, call them and they'll come, rather than, there's a parade of people who fall on you. And this is all very stressful. And a lot of people actually expect you, well, I don't know about India, but I've had to people had me get up and make them things and get them cups of tea, and their kids ran through my house and destroyed things, and then they left and I had to clean up. This is the day after, and so it can be just that, right? Not even people stressing you deliberately, just the entourage can be stressful. But certainly there's this constant pressure, and almost sometimes people just feel the right to go and grab your breast and squeeze it, and discuss your milk flow. Hello. And so you're right. It's actually, in a home birth, it takes between 3 and 5 days for the milk to come in. Usually it's 3 days. In hospitals, they found it took between 5 days and a week, because exactly, because of the stress of the hospital, because of people coming in and out, and especially in a hospital, well, not Indian hospitals, or at least in the government hospitals that I'm familiar with, the babies are left with the mothers. It's, the babies are really the patients at this point, and the mother's kind of dismissed with the babies. It's hard to explain, but so there's a lot of tension, a lot of stress. So it can take longer in an institution for the milk to come through. But it always comes through. And I've had some people come up with the idea of drink less water. No, don't do that. You don't need to dehydrate yourself. And you should also understand, and I did find this in India, that they, exactly. And I found in India, see, even the geckos agree. They have this opinion that colostrum was unfit milk, and they won't let the babies have the colostrum, and they want to wait for it to go, and they actually throw it away. And then of course there's this, yeah, and this is what babies need. We all know. I don't know why they do this, and I'm going to eventually circle around to something I want to point out in the end. Yes, Kavita?
Yeah, it was, that belief was, was there before, long before. Now I don't think, now everybody is little bit aware that they are giving colostrum, I think.
Not in India. I mean, not in Mayapur, not where I was, not in the area I was. Sorry, I didn't mean to say in India, not in my place, in the area.
No, even in India, there was a belief that they should not feed colostrum. That is a like not good milk like that. But
Yeah.
once upon a time, but now they are aware and they are feeding.
I actually read it in one of the Ayurvedic textbooks. So I'm not saying Ayurveda is 100% right every time, but I read it. that colostrum should not be given, which is totally wrong. But I think that is the basis of popular belief, something that is coming from traditions. I don't know why.
It's because it comes from a Purana that says that man, not child, man should not drink milk from the first 3 days of birth, after birth. And it doesn't specify, there's like a list of things that man should not, it specifically says man should not consume. And my belief has always been that they just implied that to everyone. And it was like, you know, because a baby's not considered a man, a baby, girl or boy, is considered a baby until they're 5. So yeah, it's in one of the Puranas, and it specifically says things that a man should not consume, and one of them is milk from like a birth of 3 days, like after 3 days of before 3 days of birth or something.
Makes sense.
Sorry.
I'd go with that.
No, it doesn't make sense.
The men don't need my, but the husbands do not need my colostrum. It's for the babies.
That way, maybe.
Karini, what did you mean? This if the mother drinks water, she'll end up with a big tummy. Are you feeling getting bloated? Is that what you meant?
Yeah, no. Here, in village side, the relatives will say if you drink water after delivery, then you'll have a very big tummy. Your tummy won't go in, so you should not drink at least for 2 or 3 days.
Oh my God.
So really, I had a mother who delivered before 2 months, and she didn't take. She took around only some 200 or 300 ml of water for the whole day. For the first day, completely, she was just like kind of nil oral for the first day. And second day, she was taking only 200 to 300 ml of water. And third day only, she started to eat foods, and she was starting to take water. And I was just really shocked. And she was complaining that she's not getting milk supply also. And I sued her like anything, like you should not do that. And I really I don't know. I was just scolded the relatives like, "Oh, don't do all these nonsense things." And they said, no, this is our tradition. We'll be strictly following all these. And this is very good for my God.
Yeah, that's what to do. That's so, but well, you know, it kind of circles around a bit. I am about the
Many things are,
reliance. Yeah, go on, Kavita.
no, many things are misunderstood. I think like there may be some reason for
Yeah,
something, but
I
there
agree
is
with
also
the
one more popular belief that after the vaginal birth, the moms are not allowed to keep their legs separated. They should always keep their leg, next to each other. Otherwise, through vagina, air will go inside, and the belly will be a big, big belly.
Yeah, that is one more belief.
Even now, people follow this.
Yeah. Well, so this is interesting because I worked in the.
It makes sense because you didn't suture in the olden times, and keeping your legs together is the best way to heal.
Yeah.
So it makes sense actually.
Yeah,
actually,
right.
one childbirth educator.
So don't give people episiotomies and just keep their legs together. That's all. that's the
That's not
basic thing.
happening.
I don't know when we'll understand this.
So, and one more thing I just want to share is like my maid, she used to say for the unhealed wounds, perineal tears, in their place, her mother-in-law, she used to use charcoal, not charcoal, real charcoal. They'll be steaming the rice, right? After getting the paddy, they'll be steaming the rice in a vessel. So that how to say, that burnt thing which is stayed in the vessel. So they used to scrap that powder, and they used to mix it with coconut oil, and they used to apply it over the wound, and the wound will heal just in 2 or 3 days. She said like that.
That's really interesting.
I mean, the burnt
Yeah.
rice which stays at the bottom of the pot.
No, not that one. The external thing, the
The top,
fire
the
will
foamy.
cause some
outside.
Okay.
that part.
Yeah.
So
Kajal,
that is,
you make kajal from that traditionally.
Yep.
yeah.
Yeah,
Outside.
right. Yeah.
Outside. She used to say that.
Wow.
And a year before, not 1 year or 1.5 years before, we went to visit five tribal villages near in Tamil Nadu, and there they used to have a room or a kind of two rooms. They used to have, and that room would be like placed, not room, that house, tiny house, we can say, that is placed little far away from the village.
Yep.
And while delivering, the mother and all the ladies in the village will be around, standing around the mother, and no one will touch the mother. No one will go and touch the mother. No one will go and support, except her mother, her own mother. So only her mother and the delivering mom will be there in the center of the room, and all the women will be standing around her, like, and they'll be just telling by words like, you can do it, you can do it, you can do it. That. So this is, and sometimes when I talk with those mothers, no, the young girls, and they said like, I was really scared by seeing all these things, so I don't want to give birth like this. I want to go and give birth in a hospital setting. And I told her that would be more pathetic than this.
Wow. Interesting. That's really interesting.
And if yeah, and there are so many medical things. I don't know whether I can say it here or not, but that tribal village, it is really some 20 kilometers far away from a normal town. Okay, and we used to walk, and we have to go there. And even there is no vehicle, no transport into that interior tribal villages. But still, after Indira Gandhi's government, the government came to the tribal villages, and they have educated the people to go with contraceptive pills to reduce their population. And the main thing is now, the tribal villages now, girls who got married, they want to go for work because they'll have only seasonal works. So while they are going for a work, if they get their menstrual cycle, they can't go for work. So their rules is like, if a woman get menstrual cycles, she should stay in that room which they have allotted, which is far away from the village. So to avoid that, these mothers would take the contraceptive pills like from day 1 to day 12. And after that, again, they'll repeat from day 1 to day 12. And again, they'll repeat from day 1 and day 12. So really, like, for months together, they don't get cycles at all. And now they have ended up with severe infertility over there. And it is a really pathetic situation. Like, I have seen a village which has around 170, not 170, 370 members in that village, with just one kid, that in the whole year, just one baby in the whole year. And they are suffering with severe infertility issues. Not only this village, and surrounding that, like 2 or 3 villages over there, they are doing this. And it is really pathetic.
I don't even know what to say or what to do. I mean, it's so, lack of a better term, ignorance and gullibility, and which only leads to tragedies. Such, these are the, I guess, where I was in Mayapur wasn't too far different from that, is what I'm seeing, or what I saw. Somebody, the subji wala came in and was trying to get me to come to the village because somebody had given birth to a cat. But I mean, I know just there is such strange things that they believed, and I don't know what to do about that, especially as they're starting to be herded into the hospital. And as we see, like we were talking about the scans and all these different procedures, which I it just shouldn't, I can't even respond to them. They shouldn't be part of the dialogue. That woman never should have had a scan, or all these women that are being given scans, they shouldn't have the scans. So there's nothing to talk about, in my opinion. There's nothing to talk about other than to say they shouldn't have had the scan, because all the problems, all the complications came out of the scan, right? Nothing came from the pregnancy. It all came from this scan. The only thing issue, and then how you were going to interpret the scan. What a bunch of garbage. I'm sorry, that's garbage. And it's just got to, somebody made the comment about, about midwives, not midwives, midwives teaching doctors. And actually, that was a suggestion from somebody significant. Michel Odant, and he's quite a pioneer for women only at birth, and uh, yeah, uh, yeah, sorry for a moment. Sorry, I just get these brain zaps at a moment and every now and then. But anyway, he was saying that women need to be alone and be with themselves, and actually, as much as possible, be by themselves if they can. I thought that was interesting about the village, the women sitting around and theoretically encouraging the mother. So what was the turning point? What did you say was the turning point that made everybody, they didn't want that? And that's why they went to
Yeah,
the hospital?
new young girls who are new married girls, they feel that is a scariest thing, and they want to deliver at hospital to make their baby safe, because maybe it is because of the education that they got from the hospitals, like due to medical camps, free medical camps, and other things, or the social media,
Well,
because they
sometimes.
have TV, they have electricity. Even they don't have electricity, but they have a phone, so they used to see.
Well, and it's also kind of, I think there's a bit of, there's a word for it, not clout, but esteem or ego in this. Not just from the doctors. I think people feel superior sometimes if they do these things. Like these young girls, to me, the new mothers are feeling, I'm thinking they're feeling superior, that this is, I'm going to do this. This is primitive. That's what I want to say. This thing is primitive.
Yeah.
So I want to do something modern and flash like the British. Exactly. Um, this is, and it's shiny, it shines. Come on, it's shiny. And you get these cool little pictures. So not that we know anything that it's telling us, but so I think there's a bit of ego in there. But really, you're looking for the comfort of women, seasoned women, loving women. And when I say seasoned, I mean women who are really bringing you out. So they're even in certain American Indian tribes, the women will be there and they'll be chanting and they'll be outside, they won't be in. they'll be outside and they'll sing and they'll chant, and invite. And in my culture, in my Hawaiian culture, that was my background, is that, you know, we all go to the house and there's a party going on, and there's really going, it's actually a party there. And that's how it happened, because they're happy doing this, I guess. And when it gets enough, the woman goes off into her bedroom, and people wander outside and the music continues, and then eventually there's a baby, and it's a celebration. And whereas there's a lot of, somehow or other, this fear, we've talked about it before, and I really feel desperate, that you need to work on the fear factor. That's got to be the number one, isn't it? I think. And I would have thought with the COVID that really, isn't that the safest thing then? Shouldn't you be at home? Doesn't that make sense? And then I don't understand. I really didn't understand this story. So this woman tests positive to COVID. You have to have your baby now, but you can't have it here. We have to Caesar you now. Why? You know, it makes absolutely no sense. They're making it up. This is what freaks me out. They're actually making it up. They're lying through their teeth, and they're getting away with it. So we've said this before. What are we going to do? We have to educate. Actually, you guys have to become midwives, I think. Seriously. Or I was even thinking, why can't you become doctors just for the ticket? Now, you know, even some people can become doctors and infiltrate and become a real doctor, become the right thing, like Gory, you know, become the real thing that you, even if, yeah, just so that you can, even if you can open up your own nursing home, it's a ticket, just a license to drive, right? Why would you not get a license to drive? Okay, in India, you might not, but you know, anywhere else, you get a license to, you're 16, you get a license, you get a driving license. Yes.
It's not easy to get into medical stream at an advanced age, of course, because it's a very competitive process, first of all. And second of all, even if somebody gives me an admission into medical school, I won't go, because I know what they are going to teach me. They are going to teach me to look at the birth as a disaster, as something to be managed. I don't want that. So no, go for it midwifery. Yeah.
Well, and definitely that, that's certainly the, I certainly won't object to that. But I, you know, get out there. And if you do a midwifery course, you do a midwifery course. If you don't do a midwifery course, look at something online and educate yourself. And, you know, I helped mentor a couple of people, and I'd like to do that again. By that, I mean not mentor by me, but help, you know, see, you know, help somebody like I helped other people go through school or something. And this is the way. Yes, Dr. Edie?
I went to medical school for 6.5 years.
Yep. Tell me.
And I was 18 then, so I had no idea. Like, for us, if you want to go in the field of medicine, you go to a medical school. And I had no idea I would connect to birthing that time. You know, I was very young. My parents wanted me to be a doctor, so I just went for it. And then I was 30 when I gave birth to my son and started taking charge of my body then. And it's been 9 years since then, 10, almost 10. And, you know, it was like a circle, like I'm in a spiral where I'm trying to understand birthing, but not from a perspective which was shown or taught to me in an institute. So, and now because I don't have the time, or I don't know if I can go to a midwifery school. I cannot see it right now that can happen.
Mm-hmm.
But I'm reading books. I'm reading books. I do look for videos online. know, professional as well as the guys I can find, and trying to educate, or trying to know, understand what next, what if not this, then what. So this is right now my journey, and would love to get mentored, because so my journey for now is how to uncondition myself and unlearn. But yeah, it's still, when I listen to Tapasya, or when I listen to Arpita, and of course you, but when I listen to you guys, I'm like, yeah, this can be done. Oh yes, why not? But yeah, so since last 3-4 years I've been uh, very hungry and thirsty for um, um, thirsty for knowledge, and yeah. So when Gauri told me about this group, I was so excited and I joined in. But 1:30 being a time where I'm at my so I have a space here called the healing space, where we have rooms and workshop rooms where I do consultations and prenatal workshops, and also the expecting mother can come there, do farming, gardening, and we're going to introduce clay and all that there. Some creativity hands-on. So yeah, I'm just trying to connect, but and in this journey has opened up ideas of farming, ideas of parenting, how to mellow, how to let it be, calm down, relax. Because I've had palpitations since I was 18. I used to have a lot of anxiety and palpitations, because that's what medical schools do to you.
Yeah.
There is so much you study and you don't connect, and nobody answers you.
Interesting.
And then they feel you are wasting their time to talk to them about. If you question pharmacology, if you question pharmac drugs, I had been that kind of a student where I was, they always were like, why don't ask questions here and there, just focus on your studies. So then now I feel the journey of those 18, 20 years in my life, I really feel this was supposed to be. That's why it went into a spiral. It was a spiral kind of a journey. But yeah, so yeah, dyes have really helped me grow. I know 2 dyes where I live in Chandigarh, and they know how to. So with 4 of my expecting mothers, they did the extra Catholic version and turned the baby. So the baby was breached, and so three went for normal birth, and one still had a C-section. So so it's very beautiful. But it's a journey. I'm still learning.
Yeah.
Yeah.
Yeah. Well, that was nice. Thank you. Thank you for sharing. And I appreciate what you're saying. Harini kind of talks about a similar experiences of being traumatized, and that's what I wrote. Post-traumatic stress disorder. You're talking about heart palpitations, and that's not little. That's something happening to you. That's a real it's overwhelming. That means you're doing it because you're being overwhelmed by what you're seeing. Traumatized by what you're seeing, and because what you're seeing, isn't right. Yeah, and then having to unlearn. And so many, I've had midwives come to me, and even a couple of doctors actually come to me after they graduated, and I taught them how to palpate. We mentioned that, how to palpate. They didn't know how to palpate. They didn't know how. I mean, how can you leave midwifery school and not know how to palpate? And I teach them how to suture, and I You know how I taught myself to suture before the days of YouTube, you know. I read a book and I could sew. It's very much like carpet stitch now, isn't it? It's just a locking carpet stitch.
Yeah, you're crazy.
Yes, I am. But it all works out. It's true. Um, but but yeah, mostly to unlearn, like you're saying, I can learn how to sit back and not have your heart in your throat. But even, and I won't say that my heart doesn't sit in my throat at a birth, you know. I meaning I am, you know, I'm at a birth. I know anything can happen, right? You're at a doorway, you are at a precipice. And so I'm sitting back and I'm watching and I'm waiting and I'm alert. But nobody feels that tension from me because I don't know, I'm not afraid. You know, it's not fear. It's not fear. That's the difference. I'm saying it's something my heart's in my throat, but it isn't fear. It's I'm ready to go. I'm ready to go. And if I need to jump, I jump. And I've had women's, in fact, one birth, at this one birth, I had to jump. And bang, you know, I was sitting there, and bang, I started moving really fast, you know, do, 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 do. And the mother, when she tells the story, she said she knew something was wrong because KL was suddenly moving fast. Meaning, you know, and normally, like I said, normally I'm sitting at first like this. Um, and then all of a sudden I just, oops, okay, we got to go to do something. Um, but, and that was her signal that something was wrong. Not because, not that there were instruments clanking on a silver plate tray, not that the lights zapped on, not that I started yelling and calling. In fact, nobody knew what I was doing. The other people, family, oh God, the other family members saw she was hemorrhaging. She just shot off a good hemorrhage. And okay. And so I just go move quickly and start. And I told you how everybody likes the lights down low, right? So I'm okay, I'm acting really normal, but I'm and calm and you know, oh yeah, nice baby, you know, and grabbing the syringe and kind of pulling it up because this is, I think I already did the shepherd's first, but it was just going. So I'm trying to draw up the syringe, and people are going, she's losing a lot of blood. Yeah, I know. Yep, I'll be right there. And I mean, all's well that ends well. But it was just funny how, yeah, that mostly, you know, like I just described a scene that's every day for you, isn't it? That's I mention it because that was a really different scene. Um, yeah, it's about getting used to it and being at birth after birth after birth and breathing, I guess. Keep breathing. And you're saying with the dyes, and of course, once you're in the institution, you're stuck, aren't you? But yeah, you're stuck. But one day you won't be, right? One day you won't be. And I'm not saying either you can get out and have to do a midwifery course. No. Why do you have to be? You just be a. You're already qualified. You're qualified. You don't need to do something more. Just get out there. All you need to do is know that everything's going to be all right, and you have the skills. If it isn't, aren't you lucky? You have the skills and you have the piece of paper that says you can do it. You know, this is you, Rudy, I'm talking to. That, you know, so you're actually in a sweet spot because your heart is in the right place. And that's your most important tool, woman. It's your heart. It's not the piece of paper. It's not the institution. It's your heart. And you've already demonstrated to me that you've got it. The fact that you can stand there and start having palpitations means your heart is very big and you know what you're seeing. So you're doing fine. You're doing fine. Just keep getting the courage, and please go there and be there. You're good. You're good.
Thanks. I really appreciate it. Thanks for beautiful words.
My pleasure, my pleasure. We need people like you. This is what I'm saying. Okay, you don't have to run off and be a doctor, but gee whiz, it's so good that you get some people who do, eh? Get people like her that's going to go off there, and that's tough, Rudy. That's tough. What you're doing is hard, and I appreciate Gori for what she did. That's hard, and she has to go through school, and she's a mother, and all this stuff. Can you imagine? And they have these big ass hearts, these huge hearts that break when they see these things. And so so they get out there and help with their perspective and their skills. So good on you, good on you. Thank you so much. And the women you're going to help, thank you so much. Yes, we need more like you. Yes.
Yeah, I would like to connect with Riddhi. I'll send you a personal message sometime. Because I'll be in Delhi from October onwards, and let's see if we can attend some births together. A home birth. I work for home births only, so let's do that.
I'm sure I can find them for you and send them your way.
I'll send them. I'll find them. People want it. People want it.
They do. They do.
I'm in Argentina, and already I have a birth coming up in India. And once I open myself, like mouth to my mouth, of course, the situation of home birth midwifery is not really good, but people want it. Urban, educated, well-paying people want home births. That's the fact today.
Everybody from all classes, they ask for it. Even if they can't follow through on it, they want it. They seek it out. So really, it's not hard to have a clientele. It really isn't. And I feel strongly that in India, you need to kind of do this. I think you need to bring home birth back, because it's not going to happen. The hospital is too far gone. Like the whole dialogue is completely alien. The dialogue around birth, medical birth now is alien and completely disconnected from natural birth. It's amazing. So more and more, I think we need to keep getting out there and doing the home births, or doing I can't see it being any other than opening our own institutions, our own maternity hospitals. Honestly, I'm in for that, to do both, because the truth is we do need it all. You need hospitals, you need surgery rooms, you need emergency bays, you need home births, you need birth centers. You need home births. I'm going to keep going back to that. You need home births, but we need to normalize. What we actually need to do is normalize birth, right? We have to bring it back to being normal, not a medical catastrophe. So the first thing I would do in anybody's practice is throw out scans. No more scans. Do not do a scan. If there's definitely not in the beginning, because there's nothing to know. In the end, assess the situation. But again, the protocol for ultrasounds are only if the care will change as a result of the ultrasound. That if you're having twins and you don't want to deliver the twins at home, have an ultrasound or a breech. But if you're going to do the twins at home, don't have the ultrasound. If you're going to do a breech at home, don't have the ultrasound. You're making trouble. There's a saying. I think Michel Odent said it too. It is from him or something like this. That if you're a hammer, every problem is a nail. So that's with medical science, and that, look at all the money that's being thrown in these machines. That's an enormous amount of money. They have to make money back. And then once that money starts rolling in, oh my God, we really want this money. It's a cash flow system and it just complicates stuff. Throw it out. Throw it out. Yeah, keep it simple. Really, kiss, keep it simple, stupid. So, don't look for problems. If you know what I mean. I mean, okay, we do. We monitor. Yeah.
Going back to what Harini was saying about moms at births, we have this recurrent topics.
No,
Moms
which
at
one?
births.
Mom's what?
That only the mom was there in the village with the woman giving birth.
Oh.
And Michel Odont in his book, I think that the one with where the man started animal husbandry and the industrialization of birth again started parallelly, because man wanted to control the reproduction of animals and women. So
Yeah.
that's a very interesting book. So in that he says that he has seen some African cultures where moms are not allowed at birth because they cannot sometimes see their daughters in pain, and
Yeah.
so and I was recently the couple with whom I'm working in Goa. I said, if your mom or mom-in-law is coming to your home birth, I'm not there. I'm not attending. Like, don't worry, they will be there.
Well, I reckon in India you might as well do that. It'd be lovely if you could.
Yeah, I'm making it a rule. Like, if you want me to for your birth, sorry, no relatives, no moms, at least not moms, mom-in-laws.
Mm-hmm.
No, they ruin the birth space, the
They
sacred thing we are trying to create.
It's
So
true.
anyway, but yeah, no, we should stick to our topic because we always digress a lot. But yeah, herbs and homeopathy and anything new that somebody used in their births and it worked, or energy medicine as well, because I feel that energy descends at a birth, in a birth space. When I'm chanting home and women, like, she's doing her stuff, I'm doing my stuff, calling the energy, and it works most of the times. It's like I'm kind of addicted to that energy that descends in a birth space.
Please spell dog there. Dog is good for energy. Is that what you're talking about? Energy in labor? Coconut water? Is that what you were talking about? About how to
No, transcendent energy that you call in a birth. Better than
Oh, gotcha. That energy. I understand. And I understand the point about the mother. Really, which is an interesting point, but the point being, at the end of the day, again, you go back to the family, you go back to that woman, what works for her. There is the odd mother-in-law, not often, but occasionally there is a mother-in-law who has an intimate relationship with the daughter, with the mother, and that they do have this connection, and then it works. Otherwise, and I had my mother at my birth, at my second birth, which was a good and bad thing. And I had family dropping in and out, which was a good and bad. No, that wasn't so good. But oh, yep. Okay, sorry. Where'd you go? Okay.
So now wants to say something.
Yeah, I just unmute. No, I didn't unmute you. Ask to unmute. I'm trying to unmute you, Savarna. Oh, she did. Anyway, I don't know what happened. Savarna, try to unmute.
She has to unmute herself.
Yeah.
She has to unmute herself, right?
Yeah, she does. Anyway, I guess she will when she figures it. So you were talking about, oh, so different situations. Yes, and you are right about that's sometimes the problem with people being at the birth is their reaction to the birth, which is why I always get together with the people who are going to be at the birth. I have at least one meeting. Now, in India, I found that often, the prime people would come to every appointment anyway, right? The mother-in-law and the husband come. Sometimes the father-in-law comes too. But I would sit down and meet with everybody at the home, not just in my house, not just in my office or in my home, but at their home. And we have a meeting and we talk about the birth and what they expect is going to happen from the birth. And we in the West, they do things called blessing ways, and they might have a ceremony in which they are really the friends and family come around, and the whole mood is to shelter and provide, throw lavish love on the mother and the baby and wish them the best. And they're giving blessings. And, blessing really is, it sounds like a simple word, but that's really what they're doing. They're walking up and blessing the mother, blessing the baby, blessing the birth process. And now these are rituals, but these rituals they're physical rituals. You're doing something physical. Everybody's coming together, and it's a very kinetic um, um, a connection that you're having with everybody. And at this point, you're trying to calm the whole point. Part of the whole point is to calm the energy down. This is something beautiful. You are being invited. I'll say that again. You are being invited to witness and share. Do not take it for granted that you will be there. I can say that in the West. Um, I think we need to start saying it in India too. But you are a guest. And I make it a point too that even now, this birthing mother, she's chosen you um, to be here because she has a connection, a loving connection with you. And she trusts you, there's this love with you. But it could be at any point in the labor, you're asked to leave. And you have to be willing to do so. That she needs to. Some women need to close off, and they really need to close off. And you may be asked to leave. And this is not personal because you're here. You've been invited to this meeting because she cares about you. But when she's about to spread her legs and have a baby, she might not want you there. Okay, you might not say it like that, but might say it nicely. um, but you get the point. And so, but also they do in different places. They do little rituals. So, for instance, in Hawaii, there'll be a place. There'll be a place designated that this is where we're having our gathering, and they will they will set it up, and there'll be little like rock, there'll be a path to this area, and there'll be obstacles in the way. You might put a tree branch or a rock, or if you get creative, you put a kid's bike in the way. Legos, now that's good. Yeah, Legos on the floor with bare feet, yeah, those work. And the real deal, so as you go, everybody goes in front of her and they start clearing the obstacles for her. They move things out of the way, and she helps and she moves things out of the way. And they go in to their blessing circle, or the circle where they're going to. And then they do, sometimes people will paint on the belly, do designs on the woman's belly. Maybe India's really good with this when the women get together and can do their sisterly sharing. You guys are kind of loving like that, right? Don't you have this tradition where you do this? So if you could bring that back into it, but it being one of support, one of trust. And the point being that you're not going to, when I had a baby and I needed a cesarean, no, it's love and trust, and you're going to have a beautiful birth. And if, I know it might be tough in this day and age, but if there can be beautiful sharing of birth stories of how beautiful it was receiving your child in your arm, and always remind the woman, actually, it's about a baby. When you're going through labor, it's about a baby. It's not about the pain. It's about a baby. And a lot of pain can be alleviated by getting them to change their focus. It's not the pain of a contraction. Your baby is coming into your arms. He's coming into your arms. And just that little change of focus can make a big difference. And that whole process of ritual and the circle of love and trust around you. These are significant things.
Yeah. Just two weeks back, we did a blessing way for a mom. It was really, really beautiful.
Yeah.
She got like earrings and I don't know what stuff from one of her aunts, her grandmom, her great grandmom, her mom, and we made an altar. We put all those things there, and everybody made a wish, and we actually had a physical water filled with water, and everybody put their hand and wished her a beautiful, peaceful birth. And she has kept that water on the altar, and she's going to drink it during the labor. And then we painted her belly. And after 2 days of that, I gave her a full body massage and a face mask, and it was beautiful. And yeah, we're still waiting for that birth. We thought it was going to be.
Yeah, well, that'll teach you. Yeah.
but the good thing is I got my birth stool, and it's beautiful. I put the photo on the group, and one artisan made it. Like the free birth I attended, her husband actually made it for me, and it's foldable. It's beautiful. So I'm thinking of getting somebody in India, finding some art, because we have so many carpenters that could make birth stools. And if a doula carries a birth stool to a hospital, if doctors don't know how to do upright births, you can demonstrate them. Some doctors are willing to learn. So it can be such a wonderful tool with the doulas. And I want to find somebody and order like 15 birth stools. Yeah, and give
do
them
it.
to doulas, and donate them to hospitals, and show gynae OBGYNs that this can be used, and this can be used so effectively, and you can avoid episiotomies and whole lot of stuff, and it would be wonderful. Oh, Harini says she has designed her own. So do you carry them to births, Harini? Yeah, so blessing way. I
Actually have that in the birth room. It's like I'll share the picture. I I don't know whether that's the right time or not. Somehow I delivered it too, but it was more comfortable for the father. But I have to with one mom. I think I'll share the picture in group.
Yes, please. That'd be great. Appreciate it. And I agree. We can get more of these things into use, and like you say, slowly but surely show how to do things standing up or squatting. And women can, I didn't mean to, but twice I gave birth standing up. Was it twice? At least twice I gave birth standing up without meaning to. It just happened. So, and some women prefer it that way. I've done it. I've attended births many times with a woman hanging off the father, you know, and I'm either usually behind, but sometimes in front. But it's good for them to get used to gymnastics and different scenarios, and trusting. That's the big deal, isn't it? The trusting. Yep. Narosha, do you have anything to ask, or you have any questions this week, or Heidi, or anyone who hasn't spoken up today?
I have one question today. Like, if there is a missed abortion, in early weeks of pregnancy, and if the sac is not completely out, so the doctors would prescribe for DNC. So, is there any herbal remedies to take out? To support the mother naturally in this process?
Absolutely. Cauliflower, the
Cauliflower. Okay.
glucohash. Yeah, cauliflower works best because cauliflower will do what the uterus needs. So I haven't personally supported a miscarriage at home, but my doulas, like the group we have, they usually support about miscarriages at home because DNC, the curettage or whatever, curettage or whatever that is, that sometimes can scrape the uterus, and in the subsequent pregnancy, people who have had these procedures more than one times, the placental abnormal placentation is seen, like biloplacentas or placenta avoiding that scarred place or abruption at that place. So DNC is not a very good thing to do actually in a miscarriage. The best thing is support that miscarriage emotionally and homeopathic with herbs, and to keep that woman at home and monitor her. If she is having temperature, if she is showing signs of infection, then only get the medical help. And miscarriages are best supported at home with the help of homeopathy. And I know people who do it, like usually in my friend circle. So yeah. So cauliflower will work.
So Kale, pennyroyal is cauliflower. Cauliflower, is there any dosage like 30 to 100?
I found everybody was different, right? So and with these things, especially with homeopathy, they are dealing on the individual person and their whole thing, right? If you look at homeopathy, they're just not looking at, oh, she's got blood in her urine. They're looking at the emotions and where they're at, right? So I found that with some people, they respond with low doses, and other people, you need to kind of knock them on the head. So as an average dose, I would usually use between 200 and 400 and 1 m if I wanted to kick something. And again, I think there's personality behind this too. My nature is to kick something. If I got a problem, I'm going to get a sledgehammer and I'm going to smash it. So I get out the 1 m. But by the time I'm pushing one, by the time I'm doing something there, it's time to push it anyway. And I would like to, now that you mention it, I am rusty on some things, but I call it colophyllum, not just, that's how I say it. I have always said it, which is the blue cohosh, right? And the other one, what's the black cohosh in homeopathy? What's black?
Semicifugia.
Is it?
Yeah.
Okay, so I will use, why can't you get these in India? If you can get the homeopathy,
No, you
homeopathic.
can get it in India. You do get it in India.
No, but if you can get the
Yes,
homeopathic,
we can do it. It is
can you get
completely available.
Can you get blue cohosh, the herb?
I don't know.
Blue.
Yeah, that's what I'm wondering. Can you get the actual herb, not not the
I think
refined
you can
product.
nowadays you can get it on Amazon. And
Any of these things you can get on Amazon, really. Yeah, you can always
and
ship these things in.
sometimes the homeopathic form will work better because it's the energy form of that herb, rather
Exactly.
than the exact molecules. So you're right, Gail. In homeopathy, you have to look at the constitution, and sometimes a woman that is sepia in constitution, that is, she's feeling depressed, and
Yes.
maybe her constitutional remedy will work to release her whatever is remaining in the uterus,
Yep.
because that will do the trick for you. So it's not just like coliphylum is universal remedy. You have to look at the constitution of the woman and remove her obstacles. Like if she's a pulsatilla woman, she's a very emotional woman, maybe her constitutional remedy will help her release the pregnancy. It's
Yeah. See, I mean, I do use a lot of herbs, and that's what I carry. That's what I carry in the back. I've got 100 ml bottles of everything, for a birth. I've got and another box of homeopathics and whatnot. I use these a lot. I'm just not throwing anything out at you because where I'm trying to keep it to your country. Homeopathy, and I do mostly herbs. So that's why I'm trying to convert. So with the blue and black cohosh, I would actually tend to give women labor tinctures in from the 36 week on. And it was a mixture of, let me see if I can remember now, blue cohosh, black cohosh, birth roots. These are all pretty common, typical ones. I forget the other two, but they'll come to me. Now I would give these, they would take drops in with water twice a day or 3 times a day, something like this. And I was never really, I'm not the type of person that actually goes, okay, 5 drops. Put a dropper full in. I'm that kind of person. Say, put a dropper full in of water and this. Do it 2 or 3 times a day. Now, having said that, I'm that way with the first time mother. I'm not that way with the second time mother. It helps with toning up a uterus and things like that. After that, you're playing with fire, or at least with my women. Maybe not with your women who are scared to death, but with my women who aren't scared. I've had the experience that you give them these labor drops and they just fly. So I stopped. I stopped giving it to multips, women who've had babies before. But I would carry it. It would be in my kit, and that's what I would give if a labor was stalling. And these are actually, when you're dealing with the herbs in this way, they are dealing with the symptoms, right? They aren't dealing with the emotions so much. Now, there is an emotional pattern that does carry over, but I don't work with it so much. Again, it is intuitive, though, when you get to know a person. Because in my kit, I have mixtures, but I can sometimes have individual herbs and stuff. So there might be 3 choices I have, and I might make a specific one for that specific lady. But really, I've got a hemorrhage right now. So with a hemorrhage, shepherd's purse, but I also can give sometimes blue cohosh and black cohosh work as well. And I said before, and this woman does it every single time. She's had 5 children. She hemorrhages every time. And the only thing that stops it is rescue remedy. Go figure. Every time. I have no idea why. But I did
rescue remedy works.
I did use it on another time. Yeah, recently in India, I didn't have shepherd's purse, so I used rescue remedy and it worked. So yeah, I would keep, and those things I think you can find in India without too much trouble. I was going to say something with one of the complications I've seen. Was somebody going to say? Sorry, I thought somebody took a breath.
I would say essential oils is a good tool to have in a doula's bag or a midwife's bag,
What is it?
because I've seen essential oils.
Oh, yeah.
Yeah,
Thank you. I was going to say.
They work. Yeah,
Well,
because I've seen lavender work beautifully when the mom was having problems peeing and a full bladder that was not letting the baby descend. Peppermint essential oil works wonderfully. Then the I I have the Spanish name in mind, but I think rosemary essential oil that brings on the contractions. So those are wonderful things to have. Like if somebody is interested in essential oil, there are so many online courses and even YouTube videos. They're there. So
yeah,
they're harmless, but they work.
and they're amazing. And I got into a habit of doing this thing. I don't know why. I kept expanding on my practice. Whatever I offered, I just kept embellishing it. And I started doing this massage for women after they gave maybe. I know where you are, Kalindi. I I I started doing these massages for women maybe a week or 10 days after postpartum, and I worked out that what I would do is just kind of bring the box of I had a special box and I take it over. What do you like? So I at one point I would go through things. I'd look at the woman, I go through my book and I think about them and I pick stuff out for them. And then this one time I wasn't so sure. So yeah, I want to. I wasn't so sure, but I I started bringing the bottles out and the women chose their own scents. They found the aromas that worked for them, and then I would just massage them. And you know what? I also like to massage. I massage the breasts. I let them know what I'm doing so they're not shocked when I do it. But when I've done it, I've never been told not to do it. And it's been very emotional for the women. I'm a woman, I'm a mother. I've got breasts. I know what they feel like. And when with my hands, I connect. I get information with my hands. So I don't know how to explain it, but you touch a person, you connect with a person, something's happening. And just the women just would become emotional. It's not like I focused on their breasts only. I did everything. Um, but there is something about that triggered something. And letdowns. Oh, by the way, another really good trick for letting a woman establish milk is getting her to laugh. If you can come up with I can come up with a comedy routine in no time. And I had this one situation, and this other friend came in, and this woman had been through a very difficult time. And she was having trouble letting down. And I love this other woman who walked in the door is a very, very dear friend of mine. And I love her mostly because she lets me pick on her. And I just started picking on her and teasing her, and she was backing up against the wall, but the mother was laughing hysterically at all the things I was saying. And then eventually her milk just started pouring down because she was laughing so hard. And so laughter is a good tool too. And I know I got off track, but with massaging with it, I'm using these oils. The women choose it. They are miracles. They are miracles. And the real deal about the whole postpartum healing is comfort, isn't it? Is love, is a loving nest, isn't it? Aren't you? Your baby comes out from the bubble in your womb and you kind of create another bubble, do you? Isn't it? Something like this? You just crawl back into bed with your baby and that's your bubble, isn't it? I don't know. But you just maintain this sacred, beautiful space. That's our job. That's the midwife's job, a doula's job. That's what we do. Yeah. Sorry. Kale's sermon of the week.
Anyway, so it's time to go, but I think in conclusion, with like knowing your herbs, remedies, everything, the most important thing is nurture, nurture, and nurture.
Yeah, yeah.
So that's love, confidence, and trust. That's all. Works like medicine with your plant.
Yeah.
I have one more doubt.
Yes, please.
Okay, I have one more.
You may have to type it. You're
Okay,
If you
funny.
want to type it, Harini.
okay.
Okay, now we can hear you. Yeah, please go on.
Okay. So what about this midwifery brew, which is used by the midwives in UK and other places? They'll be using for. I read that they are using the midwifery brew.
No,
No, can't get you.
But
No, Harini, we can't hear you. Are you asking about the midwife's brew to induce labor?
Oh. Oh, yeah, just type it like that. Did she go? Oh, she did. Aw. Okay. Oh, well, if because it is recording, I will answer. Midwife's brew. For inducing, did you say? Do you think she said?
Yeah, midwife's brew generally they use for inducing, and it has I think grape seed oil and castor oil and I don't know what, but I won't use
Oh,
it. I
right,
don't
right,
like
right.
inducing people.
Oh,
Yeah.
Harini's back, maybe. Oh, how'd you get back? Okay. Well, if she talks. We're here for you, Harini. So I wasn't sure if Tapasi was, oh, there you are. Talk.
down.
No, darn. Not working. And it's 8 o'clock. It's getting on to 8. So type it out and I will type it into the discussion, or if you like, oh, maybe you guys are shy to do that. Okay, never mind. I was going to say type it on the Facebook group so we can share bigger, but I know sometimes you guys are shy about that, so no worries. You can type it into WhatsApp. Unless you can speak now, see if you're talking now. No.
Anyway, it's time, and
Yep.
as always, yeah.
Okay, well, thank you so much. It was a lovely session. And especially Dr. Iridi, I was so happy to speak with you and meet you and encourage you. Yeah. Thank you so much. It's wonderful. And thank you guys. Thank you, all of you, so much. You mean a lot to me. You mean a lot to India. You mean a lot to Africa. You mean a lot to women, because you mean a lot to women. You mean a lot to babies, because you mean a lot to babies. You mean everything to the future, do you not? Are you not the future? You are. So you please be bold. You be bold and raise up this future. You guys, the people that you're the only ones qualified to do it. Isn't this right? Yep.
Not unless you come back and teach me.
I'm trying. I will. I'm working on it.
Will you really? Because I promise, we're building a house, and Dama wants to build a granny flat on top of the garage, and I will. Your name is on it, lady. Okay.
Yay. I'm coming.
Please, we need you. I need you.
I'd love to be there. You know that.
Yes. Well, there is a place for you to stay.
Thank you. Yay.
And it's going to be a year and a half away, but anyone who would like to come and spend some time here, I'm sure that I can put your name on it too.
Thanks. That's great. Okay, everybody. Thank you so much. Good night.
Bye-bye.
Haribo. Thank you.
Bye. Okay, bye-bye.